Government insists residents in Ontario will never need their credit card to pay for those procedures. Earlier, I spoke to Sylvia Jones, Ontario's Deputy Premier and Health Minister. Hi, Minister Jones. Good to have you on our program tonight.
Thanks for inviting me.
Minister, under the plan you presented today, how long will it take to clear the total surgical backlog in Ontario?
So there is, as we mentioned today, the biggest backlog is actually in the cataract surgeries. And we already have existing in the province of Ontario a number of community surgeries that do cataracts, most notably, of course, Kensington, where we made the announcement in Toronto. So we are going to focus on expanding the existing ones first. And then as we have legislation and making some of the other legislative changes, we hope to be able to have the other operating new surgery clinics to be up and operational by next year.
My question, though, is more one so that Ontarians can see whether the plan you're presenting is actually as effective as you say it's going to be. And so by that, I mean, if the surgical backlog right now is 206,000 people are waiting for surgeries, by how much or how quickly might the things you're proposing expedite clearing that backlog? Are you looking, for example, at 5 years from now, 10 years from now, 3 years from now? Do you have any approximation of that?
Yeah, no, we expect to be much further ahead. So as I said, we are focusing on the largest number, which is the cataract surgeries, and that will happen immediately. There are new and expanded opportunities for surgeries in cataracts in 3 locations that were announced: Kitchener-Waterloo, Windsor, and Ottawa. So those will happen right away, and we'll work through that. And then as we see the applications coming in, we will assess those proposals and do expansions beyond existing surgery capacity.
If you don't, though, have beyond the cataract portion of this, have any sort of specific approximation of how much this will speed things up, how do you know it's going to be effective? Because that's the sales point that the Premier and you offered to Ontarians today, right? The status quo isn't getting the job done. What we're presenting will be. But you're not able to tell Ontarians tonight how quickly that will happen or even sort of an approximation of when it will.
Well, in fact, we have now said what the backlogs are, what the highest number is, and so individuals and Ontarians can start to track as they see those numbers go down. We will do that work with partners in our hospitals, in our community surgical and diagnostic centers, and we've already started that work. So I think it's also important to understand that this is not just one piece. We have also invested over $300 million and offered that to hospitals who are able to expand their own surgical opportunities, whether that's through additional hours or weekends. So all of that work is happening, and we are tracking regularly through Ontario Health where the backlogs are, how long the wait times are, because we understand that people want to get back in their community that quality of life that they're missing when they're waiting for cataract surgery, hip and knee replacements, et cetera.
If, Minister, through the end of your mandate, you don't see a sizable difference in the scope of that backlog, will you back away from an approach like the one you're pursuing as of today?
I am confident that we are going to see improvements. We've already seen by investing the $300 million in hospitals, a decrease in the long waiters. We'll continue that work, as I said, but I am confident that these changes, these expansions, these new opportunities for community surgical and diagnostic centers will make a difference to those individuals who, frankly, have been waiting too long for some of these regularly scheduled surgeries.
If, Minister, you've seen a decrease in the number of people waiting for surgeries by increasing investments in public hospitals, why not continue on that track? Why is it effective management of taxpayer money to go to for-profit enterprises? What makes sense about that?
Because there is only a limited number of hospitals that we have in the province of Ontario, and frankly, building expansions. While we are doing that, over 50 either new, expanded, or renovations are happening on the capital build side of our hospitals. We also have the opportunity to expand what already happens in community, and that is these surgical and diagnostic centers. So why wouldn't we do both if it means that individuals who are waiting get service, get that surgery, get that diagnostic procedure done quickly? I think that's what people of Ontario deserve and expect from their governments.
I certainly understand that, but I guess what I'm asking you to do is address the concern that a lot of Ontarians might have, that their tax money is now going to people who are looking to make money off of doing those procedures. That is different than what we're used to, and it probably makes a lot of people feel uncomfortable.
Well, respectfully, we have individual physicians who are private entrepreneurs who work in their doctor's office every single day, who have the opportunity to bill OHIP and look after their patients. There is no pathway where a patient, an individual, will be using their credit card over their OHIP card. What I'm saying is, isn't it valuable and important to expand on an existing system of over 800 existing community surgery and diagnostic centers that are working, that are providing good customer service close to home and access, to expand that model, as well as what we've already done in the hospital system through offering additional incentives and financial opportunities to say, if you can provide more surgeries to shorten that backlog, then why wouldn't we do that?
What about if those financial incentives lure staff away from public hospitals, which you know very well are already dealing with major staff issues and major staff shortages? How will you prevent that?
So we've already done a number of things that we've seen bear fruit. That, of course, includes internationally educated nurses who are in the province of Ontario waiting for their license and ultimately approval. We have directed through the College of Nurses of Ontario to say, make those assessments quickly and make, when appropriate, give those licenses out. We have seen in 2022 the highest number, a historic number of new nurses practicing in the province of Ontario. So some of the things that we've already put in place, we are seeing bear fruit, and we have more nurses, physicians practicing as a result of it. We're also doing some longer term planning because we understand that the population of Ontario is growing, we are aging, and we need to be ready. So we have done that through investments with colleges, universities, and the Ministry of Colleges and Universities by saying, we have a plan where if you want to train to be a nurse in the province of Ontario, we have a Learn and Stay program where we pay for your tuition and your books. That has had a historic number of interested people. We're the first government in decades that is actually building 2 new hospitals in the GTA. So we've done a lot of short, medium, and long-term things that make sure our health human resources are there when we need them.
Respectfully, Minister, though, the Ontario Nurses Association says the province right now is short 30,000 nurses. Your own briefing document, Global News reported, said that retention issues arose from concerns about wage disparity via Bill 124, and your government is still appealing the court decision on Bill 124. If, in fact, you are pursuing all of that you just mentioned, why not drop that appeal at the same time to send the right message to further expand on the efforts you're making to retain and recruit staff when there is a staffing shortage?
Because while it is very important that we invest and ensure that we have sufficient numbers of individuals who are willing and prepared to train and work in the healthcare system, we also have to be fiscally responsible. And, you know, I have to say, when we gave full-time nurses a $5,000 retention incentive program, that was exactly an acknowledgement of how challenging and how much they have stepped up during the pandemic.
But Minister, sorry to interrupt, that doesn't acknowledge, though, the effect that Bill 124 had on it, on that exact issue, on the issue of retention. Why continue to pursue an appeal on that when you know it had an effect counter to what you want to happen with staffing in this province?
We also have to be fiscally responsible, which is
You have a
exactly
surplus.
what we're doing with Bill 124. And just last week I met with two internationally educated nurses, and I asked them, "Why did you come to Canada? Why do you want to practice in Ontario?" And the short answer is great facilities, great opportunities, and they want to live and work in the province of Ontario. So we're going to keep encouraging people who want to work, who want to be in the healthcare system, and there are so many who've done exceptional work, those opportunities, and these are other avenues where they can train and do that work.
Minister, I have to leave it there. I'm out of time. Thank you for your time.
Stay well.